You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in facial plastic surgery? With us, we have board-certified plastic surgeon Stephen Cohen. Dr. Cohen is the founder and CEO of Faces Plus in La Jolla, California. Dr. Cohen, welcome to the program.
Thank you, Randy.
Before we get into today's topic, tell us a little bit about your practice.
Faces Plus is an aesthetic facility that is a comprehensive plastic surgery skin and laser center. We're located right by the Aventine in the La Jolla University Town Center of San Diego. And we have a fabulous team of people because, quite frankly, these days I can't do it alone. There are too many aspects of facial plastic surgery that are outside of the purview of surgery.
So you're doing not just surgical procedures now, a lot of minimally invasive stuff.
I would say
combination of procedures?
An enormous amount of minimally invasive stuff.
Okay.
You know, these are the trends that are happening in the United States, and you know, when you see a patient, not everybody needs surgery, number one. Number two, people that need surgery are not necessarily completely satisfied by simply a surgical correction that removes extra skin when they have severe textural changes and sun damage and loss of facial fat and a variety of the other things that go with facial aging.
I should mention how I met you through Children's Hospital. Now, you're still involved with Children's Hospital. My son, you fixed his cleft lip palate.
Right.
And when I was told the best nose guy in the world, you know, adults and children, it was you. I mean, people do travel from all over the country to see you, is that right?
That's true.
I also, by the way, I should tell you, I go out of my way not to endorse the doctors on the show, but you are one of the guys that I've seen your work. The facelifts, in fact, we're going to show today are some of the best, if not the best I've ever seen. And the show now airs nationwide, and I want to thank you for coming on the show.
It's a pleasure.
Now, a little bit about your background, your training, and let's start there.
Well, I'm formally trained as a general surgeon. I did my general surgery at Columbia Presbyterian in New York and at Dartmouth up in Hanover, New Hampshire. And then I went on to do a plastic surgery fellowship at University of Pennsylvania. And I took advanced facial training at UCLA in craniofacial surgery, maxillofacial surgery, and facial plastic surgery.
Okay, at Children's Hospital, though, I mean, you're doing some serious stuff. Hopefully we could show and have time to show some of those photos as well.
Sure.
I mean, you redesign faces.
That's true. I run the craniofacial program, and I'm chief of plastic surgery at Rady Children's Hospital in San Diego. And we see children from throughout the U.S. and overseas for, you know, some very difficult facial disfigurement. And it's an absolute blast to take care of these kids and their families.
How does that help you, by the way, as a guy looking at the aging face of a woman in her 50s that wants to look younger?
Well, you know, Randy, you know, plastic surgery, cosmetic surgery is still surgery. It's not shopping for a pair of shoes. The beauty of having a background in a complex field like craniofacial surgery is that you transfer the surgical skills to the cosmetic patient. The beauty of having a cosmetic practice is you take the aesthetic skills that you develop there and your sense of art and balance and beauty, and you bring that to, you know, a population that really is underserved and tremendously in need of those skills. So it's a very, very nice balance, and things work together in a very nice fashion for both parties.
These photos, you know, one of the things we said off camera, I said, Dr. Cohen, I can spot, especially now that I get to talk to a lot of plastic surgeons, I could spot a facelift 20 yards away. In fact, I could spot a good facelift as well. And we kind of laughed about it. You said, you will not be able to tell my facelifts. So we pulled up the laptop, and it's true. I mean, you attract, you say, the person that doesn't want to look different. They want to look younger. Elaborate on that.
Well, it's interesting. At the initial consultation, you ask patients, you know, especially patients that come in looking for minimally invasive or non-invasive procedures, but have more extensive aging processes that can really be addressed satisfactorily. You want to find out, what are they scared of? Are they scared of anesthesia? Are they scared of surgery? Invariably, I think they're more frightened by looking different.
Is that what they say?
That's what they say. They want to look natural. They do not want to look different. And most of my clients would be, they would be very upset at me if they looked significantly different.
You can't see a Dr. Cohen facelift walking down the street.
I don't think so.
Really?
I don't think so. I mean, I've had patients, you know, one gentleman come back from his son's wedding and his mother didn't notice that he had a facelift.
Right.
And
But they are dramatic differences.
they're dramatic differences, but they do not look like they've been operated on.
So what's the secret, or what's the key then to a natural-looking facelift
You know,
in your hands?
I don't know, because I think some of it is having an artistic eye, and I think, you know, if the good Lord decided you're going to get one, you got one.
I know you're an artist, by the way, also.
Well, I am, and I think that is a tremendous thing going in my favor.
You work with oils, water, what is it?
Mixed media, oils, sculpture, you know, a whole bunch of stuff.
Facelifting, because we're talking about facelifting and some of the smaller procedures today. But it seems like the new buzz is minimally invasive, non-invasive. You think that's being oversold sometimes, or overstated as far as the benefits? I
think it is a very beneficial approach for younger patients and for patients that have aged especially well. I mean, there's no reason to do anything more than is necessary, you know, for refinement.
So you offer that too, obviously.
Absolutely. In fact, I always start, what is the simplest, least invasive, and in many ways least expensive treatment for a given problem, and is that the most effective? The problem lies in educating a patient as to what is most effective, because marketing brings you patients that, I want a contour thread lift, I want a this, I want a that, as if they're going to walk through a black box and magically look 15 years younger.
You say you don't like marketing for that reason?
Well, it's frustrating because most of the time you spend is trying to educate patients, not say there's anything wrong with marketing, because these are great technological advances for the right patient. And if you select properly, then a patient's going to have a spectacular result from a minimally invasive procedure. If you select improperly, you know, the patient really has extensive problems, they need a facelift, you know, but you want to capture somehow, you know, their finances, then you're going to have a disappointed patient, and probably, you know, I would venture to guess somebody who's upset with you.
So in the facelift, by the way, just to define this for a moment, what are you addressing in a traditional facelift, or your facelift? In
a traditional facelift, you're really looking at, you know, it's hard to exclude the eyes unless a patient has had eyelid surgery before. It's hard to exclude the brow. You're really looking at the degree of skin laxity, the position of important landmarks like the eyebrows. You're looking at the depth of the nasolabial fold. You're looking at the extent of jowling. You're looking then at the texture of the skin. You're looking at the soft tissue volume. Has there been a lot of fat loss? You're looking at things like chin projection. Do they have good bone structure? And then you're looking at the underlying tissue in the neck. Are the muscles apart? Is there bulging of the glands in this area? Is there bulging of certain muscles in this area?
And all of those things can be taken care of.
And all of those things can be taken care of.